Sagging facial skin, feeling a bit jowly, neck folds, want to explore plastic surgery, but not sure where to start. Most patients hear words like mini facelift, full, smash, but don't actually understand what they mean, myself included. And today we have plastic surgeon Dr. Jeremy White, who breaks down multiple facelift approaches and issues that you may be having and how to address them.
Hey, Susan, thanks so much for having me. It's going to be really fun.
Great. I'm excited. When patients come to you saying, gosh, I want a facelift, what are you seeing that they're pointing to in the mirror?
Usually it's a combination of things. So as we continue to age, it's exactly what you're talking about. It's the loosening of the jowls. Things are starting to hang, the neck. They're, especially given all the Zoom calls we do now and the social media, people are a lot more attentive to their neck and their chin. And so these are the things that tend to bother people, and we're noticing it at a younger and younger age now as well. And that's a couple of things going on. One is we have lots of technologies and techniques to help people to rejuvenate the areas, and people are realizing, well, why do I need to wait? Why do I have to be, I don't have to be 50, I don't have to be 60 in order to fix this. I can enjoy this at a younger age. So I think it's part of that is the realization that there are lots of options out there, and it's available. It's no longer just for the super wealthy to have plastic surgery. It's for everyone.
And the information out there can be confusing. There's so much of it.
Yeah, so it's very confusing because these days everyone is a expert on the social media, whether it's about politics and now it's whether it's about facelifts and medicine. So you will have people, it's almost like the blind leading the blind sometimes. You'll go on these groups and people are talking about facelifts, for instance, as if it's dogma that one technique is better than another technique and you must do it this way. And it's amazing because as you see it sort of progress, it's just an echo chamber. And then someone comes in with a problem. And it's nice because on the one hand, it's a nice thing to have because these are support groups, right? You have people who've gone through these procedures, who can help each other go through it. And there are two things going through my mind. One, why are they not going to their doctor and asking their doctor these questions? Do they not feel the comfort about addressing this with their doctor or with the staff? And just often it's just routine healing things. And then the other thing is going back to the blind leading the blind. Well, oh no, you must. They're asking other people, what should I get before they go over to see a professional? And you'll get anything from, well, honey, you just need some facial yoga and you'll look 10 years younger, to, well, you must get a deep plane facelift and this is the only way to do it. And then even within that, you will see in these groups, people saying, oh yeah, everything's great and fine and dandy. And then someone has a problem. And it's a good thing because people are there in these groups to support each other through these problems. So it's actually kind of nice to have that community. But it also brings to light that surgery it's still surgery. It's not benign. It's not like just buying a purse. You're going on an experience. You're going on a journey together with a surgeon and with the staff and everything. And things can go wrong. And all of a sudden, all these people start chiming in, oh, honey, no problem. I had a facial nerve paralysis for 9 months, but you'll be okay. It'll be fine. Go talk to your surgeon, please. Please go talk to your surgeon because there are things that can be missed and there are things that potentially can be done. Don't rely on your Facebook group for this. And I think part of that is really, I don't know if it's that people are nervous about talking to their surgeon. Is the surgeon going to get mad at me for something like that? Perhaps there's some elements about that, but I think that's a problem from the get-go. It should be that you're choosing someone with whom you can develop a relationship, who's open to all of this, who's attentive and listens to you and is going to help you through all these things. And I think that's really what separates the good from the greats. It's one of the many things. It's not just a technical thing. It's also helping the patient get through the good times and the bad times and the whole healing process.
Let's start with maybe some of the most minor kind of indications of aging that some of your patients would want to address. And what are those and what might you recommend to them?
Yeah, so the main things that happen as we continue to age are volume loss in the cheeks, volume loss in the jawline as well. You lose fat along this whole area, and you actually lose bone over time. Your soft tissues start to atrophy. All the support structures just kind of start loosening up. So as we lose mid-face volume, we lose support along the jawline, the jowls come down, the neck comes down, the muscle bands develop. So all of that happens, sort of, gravity, you can't beat gravity. So that's what happens. And on top of that, we have the weight loss revolution. I mean, these medications are miracle medications. Patients are having just tremendous changes and feeling great. They're more energetic than ever, but now they just look older because they've lost all this volume here and everything is just coming down. So that's even brought this, surgical rejuvenation to a whole new level where we're seeing younger patients who've lost all this weight as well who need surgical solutions.
So, okay, good point. If somebody does come in and they've lost a lot of weight, what do you see and what recommendation might you make?
Yeah. So it depends on how much they lost and where they are in life. So it may be something as simple as, hey, you lost, 5-10 pounds or something like that. And if they don't have a lot of true sag to everything and they just need some volume replenishment, then we can talk about things like fillers. Fillers are a great mainstay to start, right? So we want to start to reestablish some volume in the midface, along nasolabial folds, along marionette lines. Very common things you can come in and do in the office, no big deal. I think using very simple, like one of the easiest things you can do early on is just support your skin with sunscreen. Okay, so protecting from the sun. Don't smoke. That's really, really bad for your skin. And then also using things like retinol or heroin, which is stronger, and that can help you maintain collagen in your skin as you age past a certain point. So all of those things are great to start off. As it becomes more dramatic, then we start to look at other things. So for more mild sagging, we're talking about using technologies like radio frequency energy. I use things like FaceTite, for instance. I love using that along the jawline and the neck, especially when there's some fat deposits in the area. It really helps to tighten up the whole area. And I use that in combination with Morpheus 8, which is radio frequency microneedling on the outside. So I like that for sort of early signs. And I've also combined that with other suspension suture techniques like my Elevate as an arc lift. And that can give you a nice immediate result for the platysma. But again, it's really more for milder cases. After you get to a certain point, you really need that surgical redraping of your soft tissues. I mean, there's nothing yet out there that will do the same, give you the same kind of a result. And so I'll have that conversation. And I would say, I ask them straight out, like, are you ready for surgery? Like, because surgery, if their jaw is really involved here, yes, you can put filler. I've seen plenty of dermatologists, and it looks amazing on Instagram, by the way. People they'll put a whole bunch of filler along their jawline. But if you see these people in person, they have these super wide jaws. And then for women, I don't think, to each their own, if some people may love the look. Me personally, I don't see that as a feminine looking face to have a very wide jaw. In fact, many people will try to do Botox in their masseter muscles to try and shrink that in because they're looking for more of an oval shape for most people. Now, with guys, still a different story. Guys often want that, strong jawline, which by filling out here, that helps them a lot. But my point is that you have to really understand what it is that people want, what it is that they are willing to go through to achieve that step, and then assess them from a medical standpoint too. Are they healthy enough to go through these types of procedures? Is this someone who just had a stroke a year ago and is on blood thinners? Like maybe it's not time to be doing these types of things, and certainly nothing under general anesthesia, a bigger procedure. And for someone who is looking for a tweak, for instance, I'm like an older gentleman who has a lot of medical issues and has a big turkey neck. I mean, either you can do nothing, or there's even a simple procedure I can do in the office, or you can just do a direct excision of that whole area and remove the skin and the platysma muscle underneath here and tighten all that stuff up and really make a huge difference. Downsides, of course, there's a downside. It's going to have a scar there. Is it tolerated? Yeah, it's pretty tolerated because it ends up healing pretty well over time. But again, there are pros and cons to all of these different techniques. And I think, as far as the other piece of advice that I would give to people is when you're looking at facial rejuvenation, go to someone who has a big bag of tricks. Don't go somewhere, like, listen, my neck is sagging. What can you do for me? And you're going to like an esthetician or something like that. Like, it's great. Skincare is really important, but they're not going to help fix that. And they may end up pushing you to do certain procedures just because they do it, because they have a hammer and they can use the hammer, but it's not going to be the right procedure to achieve your goals. So you need to go to someone who's going to speak to you honestly about all these different options to help choose the right option for you.
When you see people with that turkey neck that can be so beautifully addressed with the right procedure, and they're hesitant on surgery, what do you see that kind of pushes them over from a non-surgical to surgical to actually address that issue?
Yeah, I mean, if I have to really sit there and hold it up like that, typically it's going to be a surgical fix. If it's something that's significant, yeah. So if they've lost 50 pounds, most likely you're looking at a surgical fix. If they're in their 60s or 70s and they have some significant laxity that I can hold on to, that's not just going to bounce back. You can tell by the skin quality. You pull on the skin and it doesn't move. It's going to be a surgical fix. It's not going to be something that I'm going to even touch with a face type device and say, oh yeah, that's going to just bounce back. Don't worry about it. So it's, but again, you have to understand the pros and cons of all of these different options and have that conversation. And even in that situation, I think it's responsible to discuss with them, what their expectations are. If let's say, okay, well, I still, no matter what, I don't want any surgery. I just want a minimally invasive procedure. Then, tell them honestly, like, well, okay, no problem. I can do this for you. You'll get a little bit of improvement, but it's not going to do this. It's just not. So, and I think only if you understand all the different techniques and technologies out there can you really speak honestly about that.
Face type. Could you just go into that a little bit more? Go ahead.
Yeah. So it's a radio frequency energy device. It's underneath the skin. It's 1, 2, 3 little incisions. We do it under local anesthesia in the office, so that's kind of cool. People are awake, listen to some music, and we inject something called 2-methylene anesthesia. So you put some fluid underneath the skin, and it numbs the area. It shrinks the blood vessels, so it's totally safe. And then what I do next is I basically lift up the skin with a little probe, a little cannula, and then go in with this device after removing whatever fat I need to remove. And I go in with the device and it heats up the tissues. And the cool thing about it is that I can set it up with safety parameters. So I can tell how high is it getting on the outside of the skin versus the inside of the skin. I can set that up before I start the procedure, and it'll cut off. So I love that about it. It's this bipolar technology. I love how you can have that kind of control and minimize problems. So that's, as far as the contraction process takes time, right? But patients are swollen for about a week or two. And then after that, they're back to themselves. And you can already, especially when you're removing fat from the submental and submandibular areas, you can see that result pretty quickly, which is kind of cool.
Is ARC different? That's your own branded version of this?
So the ARC lift is with the addition of a MyElevate suture. MyElevate suture, it's a technology that's been out for a while, a couple of years. And what that is I'll thread a sterile suture in and out of the skin underneath, and it sets up a hammock underneath as well. And what that does is it treats platysma laxity. So you can actually do something where you cut those bands almost like a little saw, and then you can put that suture in there, and it's a permanent suture. You get a really nice result from it. But again, it's for minimal laxity, and I would say probably not for someone who has really tight bands or anything like that. If it's really tight bands, I really still think that you should be going for surgery, really releasing that muscle and doing things, resetting things and resetting angles properly and things like that. But you can get a nice result from it for sure. I mean, I've seen that personally, but it's about patient selection. It's about finding the right person for the right technology. And that's really for more mild cases. Once you get to more severe sagging, if I can really pull on that skin, we're talking surgery.
Okay. I've had those platysmal bands, which are these bands right here injected with Botox, but the rationale was to fix this kind of area here more down the bottom of my neck, which my neck is taped right now, but just a little looser down here. Can we get down here with that type of procedure or no?
No, so the MyElevate suture, you can't. No, that it's really just up here. I'm curious, did you, when you got the injections of the Botox, did that help you down here?
I didn't feel like it did.
Yeah, I haven't met a single patient who, and maybe that's because, our practice selects for surgical patients, but I haven't met a single patient who has had Botox in the platysma and been wowed by it. I think, if it's something that is related to, the reason why people have platysma bands is not because they're hanging out like this. That's like a tension thing. And yes, you can relax that. You can relax that a bit, but it's often related to looseness. And so it doesn't really make sense from an aging perspective to me that Botox would fix that. That it needs to be sort of, the whole sheet needs to be ironed out, basically. So Botox is not going to do that. But from an activity phase, just like it does on the face, right? It's going to help to soften the activity of those muscles. So if you see a lot of activity on the neck when you're speaking, and it's something that makes you uncomfortable, then Botox to the platysma band's great. But don't sell me this Nefertiti lift that they were selling on social media for a while. Also, I don't know if it's still popular. Oh, we're going to give you the Botox facelift. What does that mean? What does that mean? It's Botox does not lift. You're doing something. Botox down here is not going to all of a sudden give you this lift along the jawline. I wish it did. Yeah, I was actually thinking about this recently. Where Botox might come in handy in the future, and I wonder, and still like a very small percentage of the population, but people who have large submandibular glands in the area, I do wonder if people are going to do some studies down the line where they're going to start injecting Botox into the submandibular gland to see how much it actually shrinks over time. Because it has been shown that you can inject Botox into the submandibular gland and you'll have some of the gland actually shrink, but it's temporary. And no one, as far as I know, has studied it for repetitive injections over time to see whether or not the actual volume shrinks. So it'll be interesting to see, just throwing it out there down the line. I saw minimally invasive, but the percentage of people anyway for whom the submandibular gland is an isolated problem is pretty small.
Okay, let's keep moving up. Okay, so we talked about that. So as long as we're here, is there anything that you can do to address it, or is it's just too low on the neck? You can't pull back that skin?
Yeah, I mean, you can address it by lifting up skin and muscle and redraping that. If you can do that in this upward vector, you can see that it'll kind of, it'll improve on that. So it depends on how aggressive you are and how low you go on the neck.
Okay.
Can things like retinols and things like that. I'm curious, what is it? Is it that you see wrinkles, or is that you see activity?
Yeah, it's like just kind of wrinkly, a little more looser skin, like if I were to go like this.
So that may be something that I would address with skincare, truthfully. It's hard for me to see the full definition right now, but even with just including anything that is part of your routine for your face. Also address with your neck. Also use your sunscreen on your neck. Also use your retinol on your neck. All of those things can also be addressed down here. Chemical peels can also be done on your neck, and they're great. You can even see. I've seen some. We do chemical peels. I typically just do milder peels, but you can do like a croton oil peel on the face, and the results on that are insane. For the neck, you have to be a lot more careful because it's much more sensitive skin.
Okay, I love that. I'm going to explore that more. And the peel that you said got incredible results was?
Yeah, so like things like phenol peels and croton oil peels, those are very specialized peels. You do need to go to a pro or person like that. They actually monitor you under anesthesia for a phenol peel, because you can have things like arrhythmias, changes in your heart rhythm, believe it or not, or something like that. But it is not for the faint of heart. It's not just a regular peel. That's something that someone is going to be super red and swollen for quite some time. But then after they're all kind of crusted up, you see some of these people taking off almost like a mask of their skin and reveal underneath it. That is just insane. Looks incredible. I think it's not necessarily a lost art. It's not something that's performed as frequently nowadays as it used to be, probably. And part of that may be because it's a lost art, or it's just that we have all these other lasers and people don't want to have the same kind of downtime as well. I mean, not everyone wants to can hide their face for a couple of weeks completely for something like that. If they're going to do it, then they're going to combine that with some surgery and things like that. So yeah, it's pretty cool though, for sure. It is a dramatic change.
I worked with an injectionist who was starting to inject my jowls, and I looked at her and I thought, you're just very square. I'm not loving that look. So
yeah, and that's what most people pay me to get rid of, is that as they age, everything is coming down, so their jawline looks square. And so that's the whole thing that we're trying to reverse. So yes, it will look great on a profile. It'll look great on the side view when you inject this whole area and poof it out. But from the front, man, just doesn't look right.
Okay, so same question then for the jowling. What can be done that's non-surgical, or when do you get pushed over to now this is requiring surgery?
Yeah, so for very, very minimal jowling, I will still use face type with Morpheus in the area. We're talking about small amounts on someone who's not ready for a surgery. I still prefer it in general in the neck, especially in someone who has a little bit of skin laxity and especially some fat in the area that I can remove. You can get a really beautiful, dramatic result. So I think that's still really the only other option for non-surgical, aside from hiding it with some filler as well. So the other thing that comes with that is the bargain hunting, and I understand everyone's got their own budget, right? And I think that with that I caution again, because this is your face. And yes, you don't necessarily have to have a $500,000 facelift. Like, you just don't. Not everyone can afford that. That's great. There are plenty of really, really excellent surgeons who can do a procedure that will get you an amazing result for $15,000 or $20,000 or whatever it is. Don't go looking for that $3,000 miracle facelift, because if it's that cheap, it's too good to be true. There's something else going on. So if it sounds too good to be true, it probably is.
Yeah, that's a lesson I keep learning over and over in my life. So, okay, I want to move up the face if we can. We talked about my crinkle area. We talked about the turkey neck and then the jowling. What if a patient comes in and they're really seeing kind of this cheek area hollowing out or falling?
I assess them for laxity. So I want to see, hey, if they see real rolls like this, then we start considering, like, listen, with real rolls, I can do something with filler often that will help to support the cheekbones and help to support the mid-face. You can do that with filler on your local, topical in the office, no big deal, right? Some people, my braver patients, they just use ice, and that's totally fine. There's fat grafting. Fat grafting is a much more long-lasting option. You're using your own tissues. And I combine that with most of my facelift surgeries. And I think people who get it, they get a really nice three-dimensional, beautiful rejuvenation result, because that's part of the issue, is that they've lost that volume. If they have a lot of sort of a deep roll here, and then we really got to talk about lifting and filling at the same time. So then we start talking about, adding surgery to sort of resuspend that area. And then still I'm doing some fat grafting to that area, because there was clearly part of the issue was volume loss. And I think if you understand that, then one of the worst things that people are afraid of, I think, in plastic surgery is that they're afraid of looking fake or overpulled. And that's where a lot of the problems come in, is that they're not addressing the three-dimensionality. They're just really just trying to pull as much as possible. What pulling does alone is it's just going to create a flatness to the area. Yes, it will look tight, but it's going to be very flat. So you have to delicately balance between the lifting and resuspending, but also refilling to rejuvenate the area. And by the way, the fat grafting does a really beautiful job, not only of adding volume back into the face, but it's just something nice for the skin as well. I really think it helps the skin shine. There are growth factors in there as well. So it just turns a great result into an amazing result.
And just to be clear, fat grafting is different than PRP or PRF. These are two different things.
Yes. So fat grafting means I'm taking a little cannula. Often I'm taking a little bit of fat from the belly, small incision. I harvest it. I put it all in a centrifuge, and then I'll concentrate that into small little syringes of your own fat. And I'll make 2 little puncture holes or wherever I'm treating, and then I'll place that fat into multiple different planes. And this is live tissue. So the point is that you can't just kind of plump it right in there. That stuff will die. So part of the technique is sort of like sprinkling little fat cells all over the area. And then you're allowing your surrounding blood vessels to feed it and to let it grow. So more of it will survive in the area. But the stuff that survives, that's yours. That's your own fat. So you're not going to reject it. And that will be with you hopefully for a long time. PRP, those types of things, great treatments, but they're going to do something very different. The concept there goes back to growth factors. I don't see it as something that's going to add volume. I think that's a misconception. There are, when PRF was being talked about a lot, there are signs of PRF gel. I used it for a little bit. The concept again was, okay, well, you're going to help add volume, even more volume to the area too. And it's basically, the gel is your liquefying clot almost. I don't really think that that's going to add a significant amount of true volume to the area beyond that clot that then gets dissolved by your body and then goes away. So I never really saw it like that. I really kind of abandoned it pretty quickly. But PRF and PRP do something for the skin. There are some studies that have shown that can help some dark circles. It can help melasma, even in some patients. Again, it's hard to promise anything with those types of treatments, though, because this is taking something from your body, putting it back in there, and saying, "All right, work, do your thing." It's regenerative medicine is a totally different bag, which is kind of why I'm so passionate about surgery. Because with surgery, it's like, okay, I can take that, I can move it, I can put this here. It's true artistry there. With PRP, PRF, very cool. And by the way, patients love it. It's about finding the right technology or technique for the right patients. I find that one of the hottest things that we do is, for that particular with PRF, is injecting it underneath the eyes in this area. And that's for 2 reasons. One, patients, I can't explain it from a volume standpoint, but there is clearly some regenerative process that's going on to help you build some collagen in the area, and just helps make the skin look a lot better. Because people notice, and it's not the patient necessarily just alone who's noticing, but their friends notice. And so then they send their friends and say, oh yeah, he's doing this. Is it going to be a life changer when someone has big bags underneath their on their lids and a deep tear trough? No, I'm gonna tell them this is not going to do that. It's for more subtle changes. So again, it comes down to you got to be honest though. What's it going to do? What's it not going to do? Same thing with exosomes. People are pushing exosomes, and what exosomes are these little packages of growth factors that are within the cell, and they're saying, well, they're highly concentrated, so it should be even better. But I haven't really seen great studies to really prove that. So until I can really see that, why am I going to have people put in this extra expense in doing this when I haven't personally seen real long-term multiple patient data rather than cherry-picked patients? Oh yes, I injected this exosome in the guy's scalp and he grew hair. Well, what do I know about this patient? Why they have hair loss? How much? What else were they doing? What else was going on health-wise? There's so many other factors. So if you do a real study, say, hey, I'm taking 1,000 patients, and 500 of them are getting exosome treatment, and 500 of them are going to get saline. Let's see what happens. Okay, and make it something measurable. But don't give me this whole. Often what you get is a before photo with a totally different lighting, and after photo, all of a sudden it's totally different lighting, and the hair is dyed, and it's combed in a certain way, and everything looks better. So you have to have some standardization. You have to be honest, and unfortunately, a lot of the literature regarding the non-invasive stuff isn't always honest.
Wait, before we move up into that bag area and the eye area, now I've heard there's a certain type of filler that people are even saying might regrow bone. Is that a thing?
I'm not sure what you're referring to about regrowing bone. Radiesse can help build collagen if that's what you're thinking about. It's more of a bony type substance, calcium hydroxyapatite. So it's a bony type substance. I love using it. It's off the shelf, and it's great for creating strong jaw lines or very angular cheeks. Those are probably the two things that I personally prefer it for. But some people like using it for nasolabial folds and other areas too. And so that's really great. There's actually something called Renuva as well. Renuva is something that's relatively new, and it is, talking about regenerative medicine. This is basically like, how to describe it? There's something called a cellular dermal matrix. So ADMs, a cellular dermal matrix, are sheets typically. And if you can imagine a sheet or an apartment building, and you've left all the steel beams, but I've taken out all the furniture. So that's what an ADM is. Now I just have the framework. And then the concept is that then now within this framework, your surrounding cells will come in, build a new home, and everything's cool. And now it becomes your own. So the concept with Renuva is it's a framework for fat. You inject it in the area and your fat cells will grow in the area. Still somewhat new. People are starting to push this as a potential alternative to, fat transfer to, I've seen now people are starting to talk about fat transfer to the buttocks, fat transfer to the breast with it. So it'll be interesting to see what happens as people kind of push the limits. I'm interested to see, truthfully, what it will do for the weight loss population, especially because in those patients, I found it a little bit more difficult to find enough fat for some of them to really get a meaningful volume change in their cheekbones, because they've lost it there, but they haven't just lost it here. They've lost it in their abdomen and other places, and go searching for more fat. And you're like, gosh, I can't find anything. We can always use filler, but I'm going to, lift and see what I can find, use what we can find. Usually I don't need huge volumes in the face, but it's still something that I'm closely following, because I'd like to see how that really pans out before I just start to use it willy-nilly.
Okay, that's great to know. Yeah, I think standing in the grocery lines with my kids as they were growing up, I would kind of point out, do you see this person's pores? If you don't see their pores, maybe we should think about, how that photo was altered.
Right. Well, now with AI, you don't even know what to believe it anymore.
True. Very true.
Well, it wouldn't be something your esthetician would do for sure. That like a dermatologist would do something like that, or a plastic surgeon who does phenol peels. Because again, that one's got to be done under anesthesia. But not everyone has to go through something so dramatic. You can do, even if you're just doing a peel, you can do a series of peel or a series of lasers and get really great results. Or you can do a fully ablative CO2 laser and like really get swollen and red and have the downtime for a week or two and then get a really great result like that too. So, lots of different ways to go about it. And by the way, it's the same thing in facelifting. In facelifting, just to kind of go back to that, we were talking about the chat groups and deep plane facelift is the only way. Study after study after study has shown that that's not the case, that the longevity is the same, whether you do, depending on different techniques. We had twin studies that showed no difference in the longevity between two different techniques. And this was, again, by the masters. There was a recent review article that just came out in 2026, like 2-3 months ago, talking about same thing, a review of all the literature, and again showing in the end of the day, it's not so much about what the technique was, but who's doing your surgery to get you that. So my next piece of advice to people is, don't come in asking for a particular technique. You're coming in for that person's advice about how to address whatever it is that you want, or how to address your aging face. So listen to the advice, ask the questions by all means. I totally love patients who come in and they're educated about surgery, about non-invasive or minimally invasive procedures. That's all great. But in the end of the day, whether you do, we're going to say like deep plane would be sort of a medially based technique. Deep plane means that you're going, we'll kind of start from here. You have the skin and fat, and then you have this thing called the SMAS. And the SMAS is a little tissue that's underneath, and it actually extends down here into the neck, into the area called that platysma. Remember that little muscle we were talking about that does this? So it's all part of like the sort of continuous layer here. So that's what people keep arguing about is, do you have to go underneath that layer, or is it going on top of it? The same. And again, people get into the echo chamber where they hear from a friend saying, it has to be this, or they hear on Instagram, this is the only way to do it. This is the best way to do it. Every study has shown that in the end of the day, it's about the surgeon and not about the technique. And if anything, deep plane facelifts show a 17% complication rate versus a 10% complication rate in traditional procedures. And especially when you resect submandibular glands, when you're removing parts of this tissue here to try and improve that contour even more, it's also another like 10% rate of facial nerve paralysis. Typically temporary. Most of them recover up to 3 months, but still it's something to go through. And if in the end of the day you can get the same results, excellent results with other techniques, it's a discussion, right? It shouldn't be come in, this is how I want my burger done, and have it your way. It's like, hey, I can make you a delicious burger. It's gonna look, it's gonna be amazing. I hate to compare it to Burger King. But you understand what I mean, that that it's an art form, and it helps to understand all the different techniques. I've done them all. I've done it in different ways. I will tailor my techniques to my patients to achieve the results that I need to achieve. I will treat patients with really, really thin tissues very differently than I'll treat someone who's younger and has thicker tissues. They all have pros and cons, and they all have risks and benefits. So my philosophy is I want to get amazing results, But I also want, in the end of the day, I want my patients to have an easy recovery. I don't want them to have to suffer. I don't want them to have to, be that next person on the chat asking, oh my God, my face is still paralyzed on one side. What's going to happen? It's a lot of stress to go through. And, you paid a lot of money to go through an aesthetic procedure to look better. So we want this to be a good, easy experience for you, and you're going to look amazing. That's what it comes down to, bottom line. But every study that's gone time and time again, we're talking about in the most experienced hands in the world who are publishing some of this data, and it's time and time again, it's basically the longevity is the same. So it's like, well, why are you pushing it? Just go to an excellent surgeon, go to someone with whom you have a rapport, someone who's going to listen to you, someone who's going to help you through your process, because it's not always easy. And make sure that they're make sure that they're board certified in plastic surgery, but also that they're plastic surgeons who specialize in different areas. Someone who's doing 95% breast augmentation all day long. Facelifts aren't typically something you just dabble with. Certainly not rhinoplasty either. So that's the other thing. Is like, okay, well, what's your bread and butter? What's your typical thing that you do all day, and figuring that out to sort of hone in on your search. The other part is there are lots of really great surgeons all over the country, and sure, all over the world. It's great to travel. We have plenty of patients who travel from all over, and I don't discourage that. But also, I would just caution you about going internationally. There are a lot of people who are great internationally, like world-class surgeons, right? But also there are a lot of people who are don't quite share the same ethics standards as we do in the U.S. And again, not all surgeons in the U.S. either, to be honest. But some things come to my mind, and I see a lot of very falsified before and afters. I just did recently. I was like, gosh, I saw something on social media, and it's just like it's hard to believe. It's just like it blows my mind. And I looked at the before picture, and I looked at the after picture. Like, gosh, if this is real, I am booking a flight to go there tomorrow. I want to learn from this guy, because I'm amazed. And then I looked it up. And and then I looked up online, and it turned out there was this whole story about it. And turns out that the patient the patient in the after photo actually kept getting bothered, kept saying, "Oh wow, it's your results are amazing." And he's like, "I never had surgery with this guy." So they took someone's completely different after photo, or just his regular photo, and they juxtaposed it to someone's before photo, and they presented it as they're working. Like, it blows my mind. Things I would never have thought of before. So bottom line is, I think it helps to, think locally first. And it also helps if there's an issue. Like, sometimes things can go wrong. If there's an issue, you don't want to have to fly internationally to have it taken care of.
Let's then move up to this under eye bag area. Like, at what point does it move from non-surgical to you need surgery, and what would the surgical approach be?
Yeah. So for the under eye bags, I look at a couple things. I look at what's the skin quality. So is this something where you have a lot of crepiness to the lower lids, to the skin itself? And then is there fat herniation, meaning do I see actual bags coming out? When I press on the eye, does it kind of pop out more? Those are really fat pockets that are now protruding out. And what does the infraorbital rim area look like? Does this look very hollow? Did the midface come down? So someone who's going to be a non-surgical candidate where I might use filler, which is something that kind of comes back to the people have moved away from filler dramatically. A lot of people used to inject it willy-nilly. And then we realized that over the years, and with some more recent studies also, this filler lasts a lot longer than we originally anticipated. It really does. And it can create long-term swelling to the area. So When I do that, I use it very cautiously. I'm injecting about half a cc per side, and multiple different planes to get an effect. So past that, I'm really being very, very cautious about it. I haven't completely taken it out of my armamentarium. I still think it's a safe thing to do in the right patient, but it's always in the back of my mind. That's kind of pushed up on the PRF side of things, because a lot of patients will still come in. They'll say, listen, I don't want filler underneath my eyes. I've heard about the swelling issues. I want my own natural body stuff. Great. That's where we go. So someone who's going to do that, they basically have maybe some mild puffiness to the lower lids, a small amount of infraorbital rim hollowing in the area. Great candidates for doing either doing filler for an immediate result, or doing some PRF treatments in a series to help build collagen and maybe some volume in the area. Once you're past that, then you're really talking about, hey, are you ready for lower lid surgery? And when I look at lower lid surgery, again, I'm looking at those three things. And with the skin, you can treat it with either laser. Some people will treat with laser, or you can do it with a skin pinch or remove a little bit of skin, and it tends to heal pretty nicely right underneath the eyelash margin. You can have a really well hidden scar that heals. The other part is the fat, and with the fat, there are lots of different ways to handle that too. You can handle that by repositioning, by taking the fat and trying to sort of either pinch it back into the globe. I've seen people will try to bring it down along the infraorbital rim to try and disguise it. In my experience, I think the most reproducible and straightforward technique is removing small amounts of fat from the area. And I typically do this from a flip the lid transconge approach. So I'll remove some fat from the area, and that will help to decrease the puffiness for a long time. And there are lots of patients out there, by the way, who have that as an isolated issue without a skin issue, typically younger patients. And those people, basically, you can do that surgery and they don't have any scars to show, just a little incision on the inside of the lid that you'll never see. So those are great. That's called a transcondylar lower blepharoplasty. And that last part is the infraorbital hollow. So as we age, again, we're talking about mid-phase volume loss, so loss of fat in the cheek, and this kind of comes down. And so you'll see, if you look at pictures of yourself from 20 years ago versus now, you'll see that actually the lower lid looks longer. So it's not because your lower lid just became longer. It's because you lost volume in your cheeks. And so now this is down here. So what I'll often do to take that result to the next level is I'll take fat and I'll place it along the infraorbital rim and the mid-face, and it looks amazing. It really just kind of helps to blend that transition from the cheek to the lower lid. So those are sort of the things that go in my mind. But I would say eyelid surgery is one of those things, usually not much of a downtime procedure, but really transformative.
Dr. White, what makes eyes older, aging, and what are the options?
Right. So one of the biggest things, again, gravity is our friend, but it's also our foe. So everything starts coming down. And when your brows start coming down, you start to develop a bit of hooding on the upper lid. So we're not creating new skin on the upper eyelids as we age. It's just that the brow is starting to come down. At a certain point, that brow can come down so much that it changes the shape of the eyebrow. So these are the things I'm looking at when I'm evaluating a patient on this region. And eyelid surgery is just so powerful because you can turn someone, just like small procedures, and really just make them look really well rested and just refreshed and open. So with upper lids, I'm looking at, one, do they have excess skin kind of hanging out over the upper eyelid? If that's the case, then we're talking about an upper blepharoplasty. Sometimes we'll adjust some fat in the area too, but I find that as I go on in my career, I'm taking out less and less fat from the upper eyelids themselves. And that's the reason is I think unless you really have a big pooch somewhere or it's just really super heavy, you can actually make someone look, you ask what can make you look older, hollow eyes make you look older. So that's another thing. You want to be very delicate about that. Preserve, I think, as much of that structure as you can. So upper eyelid skin, fine. We can take care of that with upper blepharoplasty. I can even do that under local in the office. So that's pretty nice, easy recovery. Tiny little stitches. So it's pretty awesome. But when that skin starts to come out towards the side here, now we're talking about you got two options. You can do a blepharoplasty and extend it out here. The scar is a little bit more visible, but tends to heal really well. Or you can add to that an upper or brow lift, basically, or brow repositioning procedure, which from a technical perspective probably has, I think, better longevity to treat the area if you add that in that particular situation. But there's a caveat to this, because I'm going to ask the patients, well, what do you, if they tweeze, a lot of people will tweeze their brows or they'll pencil them in. And so that comes into play here too, because if they have something permanent in there and I start doing this, then they look really crazy too, right? So you have to understand what they've already done, what they've gone through, what's reversible in that situation, and then tailor the treatment to attain the best result.
Thank you, Dr. White, for spending time with us today. We've learned so much about surgical and non-surgical solutions for our various desires. We really appreciate you here on Beauty Seek. Beauty Seekers, thank you so much for joining us today here on Beauty Seek. Our mission is to help educate beauty seekers as they embark on their journey for aesthetic procedures. If you like the content that you're seeing today and you'd like to hear education from practitioners like Dr. White, please subscribe. We'd love to see you.